What is music therapy? Music therapy is an evidence-based clinical use of musical interventions to improve clients' quality of life. Music therapists use music and its many facets: physical, cognitive, emotional, psychological, social, aesthetic, and spiritual. Music therapists can help clients improve their health in cognitive, motor, emotional, communicative, social, sensory, and educational domains by using both active and receptive music experiences. These experiences include improvisation, recreation, composition, receptive methods, and discussion of music. Music transcends time and is present in all communities throughout the world. Given the universal nature of music, music therapy is uniquely able to reach individuals across all backgrounds and ages. It does not require any previous knowledge for individuals to meet their goals and be successful. Music therapy provides individualized treatments to help treat individuals with disabilities, injuries, illnesses, or to improve their well-being. Some common music therapy practices include developmental work, communication, motor skills, etc. With individuals with special needs, songwriting and listening in reminiscence. Orientation work with the elderly, processing and relaxation work, and rhythmic entrainment for physical rehabilitation in stroke victims. Music therapy is used in some medical hospitals, cancer centers, schools, alcohol and drug recovery programs, psychiatric hospitals, and correctional facilities. There is a wide qualitative and quantitative research literature base for music therapy. Music therapy is distinctive from musopathy, which relies on a more generic and non-cultural approach based on neural, physical, and other responses to the fundamental aspects of sound. According to Dr. Daniel Levitin, singing and instrumental activities might have helped our species to refine motor skills, paving the way for the development of the exquisitely fine muscle control required for vocal or signed speech. Evidence suggests that music therapy is beneficial for all individuals, both physically and mentally. Benefits of music therapy include improved heart rate, reduced anxiety, stimulation of the brain, and improved learning. Music therapists use their techniques to help their patients in many areas, ranging from stress relief before and after surgeries to neuropathologies such as Alzheimer's disease. One study found that children who listened to music while having an IV inserted into their arms showed less distress and felt less pain than the children who did not listen to music while having an IV inserted. Studies on patients diagnosed with mental disorders such as anxiety, depression, and schizophrenia have shown a visible improvement in their mental health after music therapy. Types of music therapy. There are two fundamental types of music therapy: receptive music therapy and active music therapy, also known as expressive music therapy. Active music therapy engages clients or patients in the act of making vocal or instrumental music, whereas receptive music therapy guides patients or clients in listening to live or recorded music. Receptive music therapy. Receptive music therapy involves listening to recorded or live music selected by a therapist. It can improve mood, decrease stress, decrease pain, enhance relaxation, and decrease anxiety. Although it doesn't affect disease, it can help with coping skills. Active music therapy. In active music therapy, patients engage in some form of music making, either by singing or by playing instruments. Researchers at Baylor, Scott, and White universities are studying the effect of harmonica playing on patients with COPD in order to determine if it helps improve lung function. Another example of active music therapy takes place in a nursing home in Japan. Therapists teach the elderly how to play easy-to-use instruments so they can overcome physical difficulties. Music therapy used with children. Music therapy may be used with adolescent populations to treat disorders usually diagnosed in adolescence, such as mood, anxiety disorders and eating disorders, or inappropriate behaviors, including suicide attempts, withdrawal from family, social isolation from peers, aggression, running away, and substance abuse. Goals in treating adolescents with music therapy, especially for those at high risk, often include increased recognition and awareness of emotions and moods, and also improved decision-making skills, opportunities for creative self-expression, decreased anxiety, increased self-confidence, improved self-esteem, and better listening skills. Music therapy methods. Among adolescents, group meetings and individual sessions are the main methods for music therapy. Both methods may include listening to music, discussing concerning moods and emotions in or toward music, analyzing the meanings of specific songs, writing lyrics, composing or performing music, and musical improvisation. Private individual sessions can provide personal attention and are most effective when using music preferred by the patient. Using music that adolescents can relate to or connect with can help adolescent patients view the therapist as safe and trustworthy, and to engage in therapy with less resistance. Music therapy conducted in groups allows adolescent individuals to feel a sense of belonging, express their opinions, learn how to socialize and verbalize appropriately with peers, improve compromising skills, and develop tolerance and empathy. Group sessions that emphasize cooperation and cohesion can be effective in working with adolescents. Music therapy has multiple benefits which contribute to the maintenance of health and the drive toward rehabilitation for children. Advanced technology that can monitor cortical activity offers a look at how music engages and produces changes in the brain during the perception and production of musical stimuli. Music therapy, when used with other rehabilitation methods, has increased the success rate of sensory motor, cognitive, and communicative rehabilitation. Thanks for watching our video. Make sure you subscribe to receive more video related to music therapy, and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.